The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Hello, I'm Carl Seidel, host of The People's View. The show is sponsored by the Nashua City Republican Committee, and if you like to attend our meetings, they're the second Thursday of every month at 6:30 at the Crown Plaza. And if you want to find out more about our organization, you can go to nashuagop.org to see our website and learn about the events that we have.
Welcome to The People's View.
Summary of what's happening now up at the legislature with the special session.
Well, the special session is technically over. That was a one-day special session. Someday people were a little bit confused about that. What we did was authorize the task force, which has been working for the last few weeks. They will be voting on their final report tomorrow, and then we'll be moving forward with legislature, although they will be having one last public hearing just after everybody's had the opportunity to digest their report. They'll have the opportunity to come in and have that one last crack at it.
When would that be, just before Christmas?
I think it is just after Christmas. I want to say the 29th, but don't hold me to that date, around there.
Right. Yeah, I think that's a Monday, isn't it?
Could
of New Year's Day. Anyway, there's no football games. I heard that there's three different categories of legislation that you're looking at.
Pretty much. The first one, the bill and the parts of the bills that are going to be fast-tracked, all are areas that everyone is in agreement on and have no appropriation. There's no money with those. Those will be things there's some insurance things that need to be taken care of. There's the issue of making the selling of fentanyl the same class of crime as dealing in heroin. Number of small items, but very important in some areas. And then there are going to be the bills that pretty much agreed on, let me back up for a second, because those bills that everyone's in agreement on are contained in a Senate bill or will be. And we will have joint public hearings with the Senate to be able to speed that process up. So House Committee, Senate Committee will get together, have a hearing. The Senate will then make their recommendation on the bill. That'll be acted on by the Senate, we believe on the 14th of January. Then the House Committee that heard the bill with the Senate will receive that bill. They'll make a recommendation. And if everything goes according to plan, the House will vote on that on the 20th, and we should have the ability to get that right to the governor's desk on the 20th or 21st. Then the other bills would be ones that there's a general agreement on that have appropriations, are ready to move along. Those will be fast-tracked in terms of being sent to the appropriate policy committees. And some may be Senate bills, some may be House bills, but they'll be acted on either chamber as rapidly as possible and probably be finished late January, early February. Then there'll be the ones that have a little bit more, I don't want to say substance, but have more questions. Drug courts. There's a lot
more complicated.
A little bit more complicated, more money. The early ones that have money will probably be, under $1 million. Then there are others out there that have millions of dollars that are going to take a little bit more time. There's the issue like the drug courts, which people have a real misconception about that. Drug courts are dealing with people who are already in the system for felonies. Drug courts don't deal with the casual user on the street who may get himself in trouble for some petty crime. You've got to be in the system for a felony to go to a drug court. I've personally been to a drug court to observe that. It also deals with people who have alcohol issues. As a matter of fact, there are a fairly substantial number of people that do that. Next week, I will be going over to Stratford County again, which is the
See
drug
how
court
this
that's
working.
be seeing their actual graduation, see
Oh.
who's graduated, what crimes they were
Mm-hmm.
convicted of, and how that's gone. So there goes my Monday before Christmas, going over to a drug court. But I think it's important for us to really learn more about how they're actually operating. So we've got a lot of education to do in that area.
I heard
But-
a lot of good things about the Nashua drug
Yeah,
court.
there's a lot of good there, but people there seems to be this idea that it somehow is going to fix everything. It really doesn't. Stratford County's been doing this for 12 years. They've had 165 people graduate in 12 years. So it's not a huge amount of people. There are 65 people in the program currently. So that tells you a lot of these people don't even make it through drug court. If you've got 165 over 12 years and 65 in the program,
So the people that just have a misdemeanor problem.
are not eligible.
Okay, what are you planning on doing anything with them? I mean,
Not in the way, well, what we, you
not
know,
with the drug courts, but
not-
I mean, there's something
well,
else.
the first thing that people have to realize is in any of these cases, people first of all want to be helped.
Yes.
It's like an alcoholic. They have to reach that point where they say, all right, I'm ready for help. Clearly, people who are on drugs, and the drugs are much longer lasting in somebody's system than alcohol, they're not in their right state of mind, and they may not even feel that they have a problem. And so we can't help those people who don't want to help themselves. I believe that a lot of this starts with families. Families have to intervene. It's the families who really need to shake these people and say, look, you've got a problem. You need to deal with it. And we want to be there for you. The state can't do that. That's not something that we can do. But we have to have the infrastructure ready to be able to deal with those people who are ready. Because, you know, unfortunately, we're hearing cases where people want to be helped. They can't get it immediately. They're being shipped all the way out to Nevada. They're going down south. We've got to have the beds and the treatment available in state. And so that's going to be a big part of it, making sure that the infrastructure is available. But
Yeah, we've spent more, or we've allocated more money for mental health too. Now, does that mesh with this need for these other people who are drug addicts? Or?
well, I think a lot of it is intertwined, frankly. A lot of times people medicate themselves because of issues that they have, whether it's pain physically or pain mentally.
Right.
And, you know, when we were over to Harbor Homes last Friday, I think you'd agree with me, the way they're doing it is more holistic. They're looking at everything. You know, they're looking at your teeth, your physical health, your mental health. They're being screened for all of this stuff. That's a great program that we have right here in Nashua. And that's the type of thing that we need to be looking at, because you can't solve a problem if there are multiple problems, you know, only dealing with one issue. You've got to deal with everything. And obviously the private sector in these groups are much better equipped to do it than the state. Government is not the solution. We need to provide the resources.
And that holistic approach, I agree with you, is something that's very effective. And what they showed us was amazing, I thought.
It really was.
And, they even have some education in there about the effects of that too. And that's one of the other questions that I had. Is I'm hoping that part of this solution goes right down to the junior high or the whole educational system, because the people just don't realize the effect of it.
Well, I think that's true, but I think they're doing a pretty good job there. I think part of the problem is we're not doing a good enough job with pain management. There are a significant number of people who get hooked on opioids who had been prescribed medication. Of course, there are others who we have seen who have started out with marijuana or other drugs, and they just move along progressively. That's more on the education side, when they're not doing it because of pain management. Although, frankly, there may be a lot of young people who are starting on whatever drug it is because of some sort of escape mechanism for the situation they find themselves in, and they're just looking for an escape. So that's mental health. That's other issues behind there, whether it's situations in the families that need help to try to deal with those. So there's no easy solution, but we really need to continue to look at things. The reason that a lot of this has risen to the forefront is because of the deaths, and that is directly related to the fentanyl.
Right. Yeah.
And I was at the state crime lab with a few other representatives last week, I think it was, and because fentanyl can be manufactured synthetically, you don't have to wait for the poppies to grow. It's a very dangerous drug, and sometimes they're mixing it because it's cheap. But as was explained to us in the crime lab, these people who are mixing it are essentially taking a little vat, putting the stuff in, taking a handheld blender that you might, just one of these little putting it in and just zipping it around. Well, it's like mixing anything else. You're going to end up with some clumps if you're not really careful, and that's what's happening. So some of these people out there thinking they're buying fentanyl are getting straight fentanyl, and that will kill them.
Yeah. Well, I got part of my history was when I was working with DuPont, and in the 90s there was a cocaine splurge, I guess it was coming over, and we found out there was a doctor that was working on the effects of cocaine on the brain, and we came out with a film based on his studies called The Brain on Cocaine. Have you ever heard of that?
I believe I have.
Okay, because that was passed out to all the schools, and I think that was somewhat effective, showing what happens to the blood circulation in the brain. And some of it is, a crack cocaine person was brain circulation it was like an Alzheimer's patient.
Wow.
And that it doesn't recover very quickly.
No, as a matter of fact, another thing that I learned about the heroin, and somebody who's taken heroin, it's going to take 31 months for their brain to get back to normal. It's almost 3 years. Even if you don't take anything else, you're not going to be functioning normal.
That's right.
Normally for 31 months. And so it's not just as easy as just detoxing somebody like you might do with alcohol and putting them into a program. These people...
It has a lingering effect.
It has a lingering effect, and they've got to be very closely monitored.
At the time, even the social user had an effect on the brain, was showed in this film. So I'd like to see an emphasis in education, really getting these kids to understand that, or have people talk to them that have had the problem.
Well, we've had a very effective program, of course, called DARE. What I'm hearing now is because of the changes in the drugs, the DARE program is not as effective. It needs to be substantially modified and modernized, if you will. But I think the basis is there, but we need to be working on that.
Well, I'm happy to hear that. What's the rest of our session going to be like? You got us going here. Are the bills in the Senate and the House going to wait for the crossover, or they do? Some of them get done earlier.
It depends. I mean, generally, obviously, some of these bills dealing with the heroin will, if it's a Senate bill, it's going to get to us. We'll probably act on it right away. Most bills will wait till crossover, but there will be exceptions probably in both chambers, depending on what the subject matter is. Obviously, the other big issue is going to be the issue of Medicaid expansion, and how that plays out is going to be hotly debated. And but we don't have any urgency there. Medicaid expansion's in place till the end of 2016. So when we get it out of committee and out of the House doesn't matter if there's a bill that we can agree on.
Yeah. Are we supposed to look at the other solution of private insurance as well as Medicaid, or is that?
Well,
how's that work?
I don't know that there's too much we can do with private insurance. I mean, we don't control that market. Obviously, Obamacare has really made a mess of things. There's substantial problems with the Medicaid expansion because part of that, it took away the asset test. The feds are not giving waivers for requiring people to work or seek work. That's a real problem because this isn't for people who are just at the poverty level. This is for people who are at 138% of the poverty level. So they're not making a lot of money. The problem is with most of our social programs like this, most of our welfare programs, if the limit's 138% and you start making 139%, you lose the whole benefit. There is no incentive in these federal programs for people to better themselves. There should be a sliding scale. You shouldn't just say, well, if you go over this limit, you're done. Why would you go over that limit? Because if you go over $1 over the limit, you're not going to be able to afford the program. It's crazy, but this is what Washington has done to us. They're not allowing us waivers, which we should be able to get. Every state should be able to get. There should be more co-pays in there. There should be incentives for people to get jobs, to work. Most of the people, not all of them, but a large percentage are young, healthy males who just haven't been able to find a job and need this help. So it's by no stretch of the imagination is it an ideal program, but the federal government today is sending $500 million a year into the state to support this, which is resulting in less uncompensated care for the hospitals, although I'm being told, at least right now, the emergency room visits are up, but the cost is down because of the insurance. But people are it's only been in place for 18 months. The hospitals are transitioning people to go to urgent care, to go to primary care physicians, which those are good things, obviously, because as you know, if you get preventative medicine, the costs are much less. If you wait until suddenly you're so sick you can't walk anymore and you've got to go to the hospital, now the cost of recovery is huge. The one thing that I've made very clear to everyone is I will not support any expansion if it involves spending additional state funds to do that. The state didn't ask for this program. The state shouldn't pay for it, but there are 44,000 people on it. If we just take that money away, those people are still going to have the same health issues, they're still going to have the same cost, and that money is going to go someplace else. New Hampshire is a donor state, as it is in terms of federal income tax. We already pay more to Washington than we get back. I'm hopeful that when we get a new administration, and obviously we will have one a little over a year from now, hopefully they're going to start to be reasonable. Hopefully Congress will be reasonable, and we'll get waivers in place to increasingly make it a better program. But obviously, the hospitals, the providers are getting this $500 million, which in the next couple of years will go down to $450 million. If they're interested in this continuing, they need to figure out how to make up that additional $50 million, or it goes away, in my opinion.
Well, didn't a lot of the people that took up this program have private insurance before?
Many of them did. That's a whole problem with the whole Obamacare and
The way it was structured.
way it's structured. I mean, this program is just an unbelievable mess. If we had taken every uninsured person in this country and just paid a private rate insurance for them, we would have saved billions of dollars.
Yeah.
This is just an incredibly stupid program the way it was done. But I think we all know why it was done the way it was done.
Well, we do, I think, but hopefully the voters know, too.
I hope so. And hopefully they send the right people to Washington so
Yeah.
we can fix these problems.
Yeah. Well, you hate to cut somebody off, but at the same time, you don't want to expand it to do more harm.
Exactly. And that's why I'm committed not to having the state involved. There would, if anything can be found, and there'd be a trigger mechanism, so if the funding isn't there, the program goes away. Regardless of that, I'm leaning to the point of saying, all right, we know Obama's not going to give any waivers, but if we could structure something saying that by July 1st of 17, waivers would have to be submitted, and if they weren't approved by December 31st, then the program could also go away. Because it's just, there are other states that are trying to do the same type of thing. They're not getting the waivers, and the waivers need to be in place. We need to figure this out, because we all suffer when people don't have insurance, because we all pay for that. Unfortunately, with this crazy program that has been in place, we're still paying for it. Insurance rates have continued to go up at roughly the same rate they were going up before we had this. So there's been none of the promises that were made to the taxpayers have been kept by any of these programs. And yet the president hasn't woken up. Congress can't do anything about it, obviously, without the president signing on. And he just hasn't woken up to the fact that his legislation was really fatally flawed.
Have you heard of any other states that have had some either waiver granted?
Well, there have been some. They will not grant work waivers. And there are limits, I think, on how much they will allow for co-pays, for premiums that you could pay if you get a program, because some of these people are working. Some of them used to have insurance.
That's right.
So there's got to be incentives. And again, there's any program, whether it be food stamps or anything else, in my opinion, you need to allow people to earn a little bit more. Maybe, for every dollar you earn, you lose 50 cents of benefits or something, so that there's a benefit to you advancing yourself. There's no benefit in any of the programs we've got. And frankly, that's how some people in Washington like it. You have a dependent class, people who cannot get out of government dependencies because the programs are specifically designed that way. How stupid is that?
I can't believe it either. I know I have a brother-in-law who has a business, and it's in Florida, and it's one where there are a lot of minimum wage people, and he has people that he can't get to work overtime because they don't want the money.
Well, and it's probably not so much they don't want the money, they can't earn the money without a massive loss.
With a change in the benefit. That
without
they're
a
able to
massive
pay.
loss of benefits. That's absolutely crazy.
Well, let's hope we can do something about that.
Well, we've been talking about it for a long time, and the votes just don't seem to be there. It's funny, I think on some level people in this country seem to like divided government, but then when that divided government can't get anything done, the people complain about it.
Wow.
Well,
That's where we are right now.
Who gave us the divided government?
Well, what else do you see coming up in the session that might be of
I've got to tell you right now, while I have been looking at bills, I just read through 108 reports on retained bills, getting through those. So I haven't.
Retained bills are ones that were brought up and
and they were studied
Yeah.
by the committee. They were retained to study, and those are all coming out. That'll be the first week. So there's some interesting issues there. There's going to be a lot of fights. Nothing of real importance really rises to the top of my thought process here. There are a few bills dealing with legalization or decriminalization of marijuana. I do not believe this is the right time to have this discussion with the heroin problem, because so many young people, one of the people they heard from was Alex, who's actually from Hudson. Alex's story about how he became a heroin addict. And it had nothing, came from a good family, had nothing to do with pain, it had nothing to do with family problems. He just started out with marijuana, and he says this is a gateway drug. And he said he wanted the bigger high, So for us at this time, when we're trying to deal with heroin, at one point to then say, well, let's legalize this. Now, let's face it. It wouldn't be legal or decriminalized for anybody till they're 21. I don't think I know anybody, I may, but I don't think I know anybody who started smoking marijuana after they were 21. Just like I know virtually nobody who started drinking beer
Right.
after they were 21.
Yeah.
If you're going to drink or do marijuana, you're going to do it before you're 21.
Mm-hmm.
But the message is it's really okay.
Yeah.
And until we get a better handle on this, I don't think we should be saying that. I was at a speakers conference in August, and I spoke to the Speaker of the Colorado House.
Mm-hmm.
Now, she's a Democrat. She does not like what they did in Colorado.
Mm.
She thinks it was a mistake. I've been hearing from people who have been out there visiting, talking to law enforcement. They've got people who are just zoned out on the streets now. They're just totally non-productive members of society, just essentially littering the streets with people who are stoned. And of course, not everybody treats drugs that way, but once you make it legal, you create other problems. But the biggest problem with this is there is no way to accurately record the level of impairment.
Mm.
So how do we
Yeah.
deal with drivers?
Mhm.
Right now, hey, you roll down a window, the car,
Take a blood sample. Yeah.
but right now,
Yeah.
you roll down the window and, you know, the marijuana's coming out, you're probably going to find the drug in there, there's a process. But once it's legal, well, that doesn't matter. And we have the right in New Hampshire to say, no, I'm not going to get out of the car. I'm not going to take a field sobriety test. You've got implied consent, but the officer first has to determine whether he wants to place you under arrest.
Mm.
So at that point, all he has is the evidence of the driving before when he pulled you over. You know, you can be, not take a breathalyzer, but once you're arrested, you know, there's different options. With marijuana, it's going to be solely what did the officer see. Gee, I reached down to grab a cup that fell on the floor. How do you prove that?
Yeah. Yeah.
In the test, first of all, there are very few officers in the state who can even give the test because it's not the same field sobriety test that you give for alcohol. And there's almost nobody trained to do that, very few. It's a whole different ballgame.
What do you feel about the medical marijuana? Because there has been a push on that.
Well, I think that there are probably some merit to that. I mean, we've passed it, it's going to be the law, but I've always been concerned that there is actually other ways to get the same benefit from the marijuana than to smoke it.
Mm-hmm.
And that I'm not sure we explored that enough.
I think that might be necessary because I think that gets the sympathy for doing it, but you want to make sure it's regulated so that people aren't saying, "Oh, I have a headache, I need medical."
Yeah, and certainly somebody who's terminal,
Right.
you know, smoking isn't going to kill them, but you know, smoking anything is bad for your lungs. So if this is a chronic pain management, but now we're telling them to smoke, okay, well now we've given you lung cancer potentially. You know.
Well, we'll see.
So none of these issues are easy issues, and a lot of people feel very passionate about the issues.
Yeah. Well, I can understand the medical more than I can understand the other one, but we'll see. Well, we've finished our time.
All right.
So thank you for your time. Then I'd like to make sure we can get back together maybe in a couple more months and see what's happening with all these things that are going through the process right now, and see where we have any bumps or whether we have a little smooth road in some place.
It'd be my pleasure to do so.
Well, very good. Thank you very much,
You're welcome,
Mr.
Colonel.
Speaker.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.